Happy New Year, everybody. Let's start over. Thank you guys so much for joining me. I really appreciate you guys. You're wonderful. And I'm so happy to be here for you. I wanted to let you guys know, first and foremost, that I did get my coronavirus vaccine on Monday, and I have had no side effects whatsoever, except for a little bit of muscle soreness. So if any of you are nervous about getting the vaccine, my personal experience was that it was really easy. It hurt less than the influenza virus vaccine. So I think that it's really, at least in my experience, been very safe, and I'm going to get my booster in a couple weeks. Okay, so as far as the other thing I wanted to announce before we get started was today is my mom's birthday. And I know she's not actively watching right now, but I wanted to wish you a happy birthday, Mom. I love you very much. I wish that we could celebrate together. Unfortunately, I know that circumstances are not such that we can. Okay, so I'm going to get to some of the questions. I'm going to go back up, and I saw one about how can women treat vaginismus. And vaginismus is a disorder where women have a lot of pain at the initial penetration of intercourse, and the male cannot enter. And this is again for heterosexual intercourse. And so during this time, this is a very traumatic experience for both parties involved, and it can be treated. It does take a lot of time and effort to get better from that circumstance. Very typically, the most common treatment to start off with is pelvic floor physical therapy, where you work on relaxing the pelvic floor muscles, which are clenching down. And very commonly, this happens to women who have a history of trauma or sexual abuse. So it can take a lot of time and dedicated effort, but it can get better, and you can have a sex life that is enjoyable after having that. Another question I saw was about erectile dysfunction. So after prostatectomy, so someone commented that they had a prostatectomy or removal of the prostate and subsequently had erectile dysfunction. So how do you treat that? Well, one, I want to let all of you know that this is a side effect of sometimes having a prostatectomy, depending on how wide you need to go to remove the prostate, because there are nerve bundles around the prostate. And if the nerve bundles are affected by the surgery, it can reduce your erection. So the ways to fix this, the ways to treat erectile dysfunction include medications like Viagra, Levitra, Cialis are the brand names. And those medications all work by acting on a certain receptor that allows more blood flow to the penis. And you need to have you need to have foreplay for them to work. In order for them to work, you need to have some, because there needs to be the stimulation for the medication to start working. And you need to take them about 30 minutes before intercourse, and you need to take them on an empty stomach. If that doesn't work, there are vacuum erection devices, which can be prescribed to you. There are intraurethral suppositories, which are these tiny tablets that you put in the pee hole or the urethra. And there are intracavernosal injections, or injections that we teach you how to give yourself into the penis. It's a very small needle. I know that sounds super scary, but it's a very small needle. In fact, when we do them in the office, patients are always like, "Oh, are you done?" Because it really doesn't hurt very much at all. And those are the most effective. After that, there is surgical interventions like penile prostheses, or essentially inflatable penis implants that you can get. And I have a couple of videos on these, so you can check them out. One is on Grey's Anatomy, reacting to Grey's Anatomy, where an older gentleman gets a penile prosthesis. All right, let me see what other questions. Is it abnormal to wake up to pee once or twice a week? So what's normal for waking up at night? If you are below the age of 55 or so, it's not really considered normal to wake up at night, but waking up at night is is caused by a number of different things. So you can wake up at night if you're above the age of 55, usually once. If you're waking up more than that consistently, then it may be something you want to talk to your doctor about. But the things that you can do at home is watch what you're drinking before bedtime. So 2 hours before bedtime, try not to drink anything, or just sip on a little bit of water if you need to take some pills before bedtime. But trying to avoid drinking before bedtime can help you. Also, just working on sleep hygiene can be helpful, because you might be waking up for some some other reason and then going to the bathroom. So figuring out going to bed at a consistent time, avoiding blue lights before bedtime, and trying to go to sleep and wake up at the same time in the day can help you with that as well. But once or twice a week, probably you're drinking a lot those nights before bedtime. I wouldn't worry too much about that. Okay, so someone asked about a transurethral resection of the prostate. So a transurethral resection of the prostate is a treatment for benign prostatic hyperplasia. And there are actually a number of treatments for this problem. And what it is essentially a large prostate. All men get the large majority of men, I should say, get a large prostate. About 80% of men, when you do autopsy studies, have a large prostate. But that doesn't mean that all men have symptoms of it. And how would you know if you have symptoms? Well, if you are going to urinate and you are finding that you're going more often, going more frequently during the day or at nighttime, that can be a sign of BPH. Or it can be that you're straining to urinate. You're feeling like you're not empty when you're all done. Your stream is weak, or that you're stopping and starting when you urinate. If you're having these symptoms, one, if you are really emptying your bladder okay, you can do nothing about it and it's okay. If you're not emptying your bladder okay, which you would find out by seeing your doctor, by seeing your urologist, then you should consider some treatments. And the treatment options are medication like tamsulosin or alpha blockers, which help relax the smooth muscle of the prostate and allow urine to pass more easily. Also, a very common one is something called finasteride, which is a medication that actually shrinks the size of the prostate over many, many months. It is a commonly used medication, but there are significant sexual side effects. So I warn all my patients about this if they are considering trying this medication, and that it's going to take a long amount of time. There are also the medication that I mentioned earlier for erectile dysfunction called Cialis or tadalafil has also been studied. Taking it on a daily low dose can also help allow urine to flow better. And I've had really good success with that with some of my patients, especially if they're also suffering from issues with erections. If those don't work, then there are a number of surgical options. The gold standard, or the one that we've been doing for many, many years, is a transurethral resection of the prostate. And essentially what that is we call like a roto-rooter. We go in when you're asleep into the urethra and scrape out the prostate and take so that there's more space for urine to flow through. Traditionally, this used to be kind of a scary operation because we would use a certain kind of current, and we could only do an hour or hour and a half worth of surgery. And otherwise, if the type of fluid that we needed to use if we went too long, the type of fluid that we use would get absorbed into the bloodstream and then cause things like hyponatremia or confusion. But nowadays we have what's called a bipolar current, which makes it much, much safer to undergo this procedure. The big risks with this procedure are bleeding, infection with any urologic surgery. Really, you can get a UTI, a urinary tract infection. Retrograde ejaculation is a big one. So whenever you're doing a surgery for your prostate, there are only a couple that don't cause retrograde ejaculation, but the large majority of them do cause retrograde ejaculation. So you need to be aware of that before you have the surgery. And then alternative, there's a very small risk of stress, urinary incontinence, or leakage when you cough, sneeze, or lift something heavy. However, I would say that there are a number of new options coming out on the market that have been around for a few years that have done quite well. There is the laser prostatectomy has been around the longest, and that's actually pretty equivalent to a transurethral resection. It has lower bleeding risk, and so people like to use that procedure preferentially if someone's on aspirin or medications that cause blood thinners. There's also the Resume therapy, which is water vapor therapy. So they use water vapor to basically eliminate some of that prostate tissue. Or there is the UroLift, which is actually using a suture that's embedded into the prostate that kind of lifts the urethra up so that the channel can open up. And there's aqua ablation, which uses ultrasound to map out the prostate and then uses like a water power to ablate the urethral, the prostate tissue, and also works quite well. So all of these options are available, and you should talk about them with your urologist. All right. So my mom is getting older and she leaks with coughing. Is this a normal occurrence? So leaking or having urine leakage with coughing, sneezing, lifting heavy things, jumping, exercise, that is called stress urinary incontinence. And a lot of women think that this is normal. Well, it's actually not normal, and it's a sign that there is some weakness in the pelvic floor. And if it's not bothering you, sure, you don't have to do anything about it. But if you are bothered, there are options to improve your quality. It's not dangerous, but it can really make you self-conscious and make you uncomfortable. So there can be treatments such as pelvic floor physical therapy. There are treatments where they teach you how to do pelvic floor exercises or Kegel exercises. And you can see my last video on Kegel exercises so you can learn more about that. And there are treatments like a pessary, which is a dish-shaped device that goes into the vagina that can hold up the urethra to help prevent leakage, that we teach you how to place and fit you for. Or there are surgical options. There are what's called bulking agents, where we look in the urethra with a camera and inject a bulking agent on either side to help have a little bit more resistance when urine passes. There is also a sling procedure. So there are sling procedures using mesh or using your own tissues that can help provide a hammock of support underneath the urethra when you are coughing, sneezing. And each of these have their own risks and benefits that you can talk about with your urologist. Or if you want to hear more about it, comment below and I can make a video on it. All right, let's see what else we've got here. Okay, what age should men start a colon or prostate exam? So the prostate screening starts at the age of 55. So I recommend that all of men should at least get a prostate exam and a serum prostate specific antigen at the age of 55, unless you have risk factors, which include a family history of prostate cancer, which include so that means a brother, a father, an uncle, a grandparent who had prostate cancer, you should come see sooner. If you are African American, African Americans are a higher risk of getting prostate cancer, so you should come see your urologist sooner. Or if you have a family history of some genetic disorder like BRCA1 or BRCA2, which has been linked to prostate cancer, you should come get your screening done sooner. And that entails, like I said, a prostate examination as well as a serum prostate specific antigen, which tells you a risk of having prostate cancer. All right. Okay, let's see. Sorry, it's a lot of questions here. Okay, so a lot of questions, how to make your pelvic floor muscles strong. So doing Kegel exercises, which I talk about in my last video about pelvic floor muscle exercises, can help make your pelvic floor muscles strong. But the best way is to see a pelvic floor therapist or someone who is certified in pelvic floor muscle treatment, and they can help you make sure you're doing the exercises correctly and help you get your pelvic floor muscles stronger. And the benefits of getting that strength for women is to improve their continence or their urinary control, to prevent prolapse or pelvic organ prolapse. And for men who are suffering from stress urinary incontinence, meaning leakage when you cough, sneeze, or lift heavy things, those exercises can be extremely helpful. Is there any cure for premature ejaculation? So there are treatments for premature ejaculation. In the United States, they are mostly off-label. And I talk about these a little bit. I made an old video reacting to Sex and the City, but essentially there are some non-medical treatments you can do, like the start and stop method. So getting to the point where you're very, feeling excited and then kind of stopping and then resuming again can help you work on improving your length of intercourse and preventing premature ejaculation. There are also treatments like EMLA cream or lidocaine cream that you can put on the penis about 20 minutes before intercourse that can help increase the length of ejaculation. And there are medications, specifically antidepressant medications, that have been shown to improve the length of ejaculation after starting them on a daily basis. There's 1 or 2 that have been shown to be taken on demand as well. These are all off-label medications, but they have been shown in studies to improve the length of inter-ejaculatory latency time, or the time that you can have intercourse before ejaculation. Is peeing every 30 minutes or every hour not normal? So yes, that is not normal. Urinary frequency is defined as going to the bathroom more than usual, which in our field is considered greater than 8 times a day. So if you're urinating more than 8 times a day, you have urinary frequency. What are the causes of this? One can be drinking too much fluid. So if you're drinking a lot, you're going to go a lot. One can be if you are constipated, that can cause pressure on your bladder and make you need to go to the bathroom more often. If you are having too many bladder irritants, and I've made a video on this as well about bladder irritants, but things like spicy foods, alcohol, caffeine, artificial sweeteners, those sorts of things can make you go to the bathroom more frequently. And then as well as being overweight or smoking, those things can contribute to having urinary frequency. If all of these things are good in your life, you may have a condition called overactive bladder. Or you may have, if you have a prostate, it could be from having an enlarged prostate. And there are treatments available for each of these conditions to help with your urinary frequency. All right. Does workout in the gym have any adverse effect on your sexual well-being? Absolutely not. In fact, exercise has been shown in men to boost your testosterone levels, which can increase your sex drive, which is great. And for women, exercise can help with a number of different things: stress reduction, weight loss, and overall, just well-being, which can then help you feel more at ease to have a more enjoyable sex life. All right, let's see. Okay. UTIs and prostate infection, are they the same thing? So urinary tract infections and a large prostate are not the same thing. If you have a prostate infection, it may present as urinary tract infection, as your infection in your urine, but if it's coming from your prostate, that's a different problem than if it's coming from your bladder or urinary tract. And it's important to differentiate those because the treatment of each of them is different. When it's coming from your prostate, it typically needs a longer course of antibiotics to really clear that infection and to make sure there's no source of infection in the prostate, like an abscess or something like that. When it's from the urinary tract, again, we want to figure out what is causing it. Is it from the kidneys having a kidney stone? Is it from the bladder having cystitis, or other things like that? And if it's in men specifically, it is a very concerning thing to have a urinary tract infection. Men generally don't get uncomplicated urinary tract infections, so you need to see a urologist to find out why you keep getting infections so that we can help you treat them. InterStim surgery for OAB, great question. So I do a lot of InterStim in my practice. InterStim is a third-line therapy for overactive bladder, which means that you have tried conservative management, you've potentially tried medications, and now you're still suffering from problems with overactive bladder. And what InterStim is basically a bladder pacemaker. So we have a tined lead that goes in your backside alongside the nerve root that stimulates the bladder, and it improves normal bladder function. Essentially what it is approved for is urgency urinary incontinence, so the leakage when you gotta go, can't make it. For overactive bladder, so when you have urinary frequency going more than 8 times a day, nocturia going more than once at night, or also non-obstructive urinary retention. So if you can't pee and they can't find a cause for you not being able to pee, meaning it's not because you have a large prostate or a narrow urethra or some other reason, then you have non-obstructive device can help with that. It also helps with fecal incontinence. So when you're having accidents with stool. The nice part about this treatment is that there is a staged procedure. So I typically do the first stage either in the office or in the operating room, depending on the type of reason that we're doing the procedure. And you wear this lead with an external battery for a week or two, and you let me know if it actually improved your symptoms. If it improved your symptoms, then only do we implant the pacemaker. And the success rate is about 80%. So I think that it's a great operation for people who are suffering from this problem because it can give them back a significant quality of life. There's a lot of options for third line treatments for overactive bladder. There's Botox injections in the bladder, as well as what's called peripheral tibial nerve stimulation, where you receive a kind of acupuncture needle into the ankle where your peripheral tibial nerve is, and that stimulates that nerve that goes up again to the nerve root that stimulates the bladder and the pelvic floor. Typically that is really low risk, but requires a lot of time. You have to come to the doctor's office once a week for 12 weeks and then once a month thereafter. Have you ever had to castrate one of your patients? How did you help them deal with the trauma of it? What are the options for a man who has been castrated to get his sex life back? Well, unfortunately, I have not had to do that for any of my patients. And so usually it's been one testicle removed for a cancer or something like that. But it is a very traumatic issue if men do undergo it. You can get a testicular prosthesis, so that it can rejuvenate the appearance of having testicles. And then you can take testosterone replacement therapy, which can help you feel the same kind of things that you normally felt with libido and having good muscle mass and good cognition, those things that you lose when you lose testosterone. All right. Explain neurogenic bladder, please. Happy to do so. So neurogenic bladder is essentially when you have a neurologic disorder that affects the connection between the brain and the bladder. So this can happen due to a number of neurologic diseases that can include strokes. It can include multiple sclerosis, Parkinson's disease, any sort of traumatic brain injury, any sort of spinal cord injury, and a lot of different things. Even if you have kind of disc issues, you can have issues with your bladder function. And what happens is your bladder is essentially, when you think about bladder function, you think about the bladder, which is like a balloon, and the outlet, which is where your urethra is. And the neurogenic bladder can affect either of those areas. Very commonly in neurogenic bladder, you can have what's called an overactive bladder. So the bladder has these contractions before it's ready to urinate. You can also have a bladder that doesn't squeeze at all, which is called underactive bladder. And so it doesn't squeeze, and so you can't empty your bladder. Or you can have problems with the outlet. So you can have an outlet that is wide open, so you have constant incontinence, or you can have an outlet that doesn't relax. And so when you need to urinate, normally your sphincter opens up to let urine pass through, but in some cases it may not. So there's lots of different ways that the bladder can present if you have a neurologic injury. And so really, you need to see a urologist if you have a neurologic injury and bladder problems, because we can help you navigate that, figure out what's going on, and make sure, most importantly, that your kidneys are safe. Because the bladder is where your urine collects from your kidneys, if there is a problem with the stiffness of your bladder due to your neurologic injury, urine can actually back up into the kidneys and create problems for your kidney function. So my goal as a urologist, when I see patients with neurogenic bladder, is one, to make sure their kidneys are safe, two, make sure that they are happy with the way their bladder is emptying, three, to make sure that they are not having bladder infections, and four, to make sure that they're having good sexual and bowel function as well. All right. Someone asked if I have an office in New York. I don't have an office in New York, but I do have a medical license in New York, Maryland, and Texas. So if you are in any of those states, I can see you as a virtual visit. If you are not in those states, I'm sorry, I cannot see you or consult with you because I don't have a medical license for those things. There is no surgery for premature ejaculation. There was a question there. How much do penises vary in size? So the average length of a penis, as I mentioned in one of my popular videos, is about 5.7 inches, and they can vary pretty significantly. On the bell curve anywhere between 3 inches to 8 to 9 to 10, but the average is 5.7. So that is the average length. If you are below 2.8 inches or so, you may qualify as someone who has what's called a micro penis. But that is very rare, only in 0.14% of the population. So not something that most people have to deal with. Okay. Is it possible to increase the size of the penis? So I made a video about this. There is no great option available to increase penile length. You can try a penile traction device, which would require use for multiple hours, for multiple months to see a benefit, and that can last, that can maybe give you about 2 centimeters. It doesn't work for everybody. So those are things that you have to decide for yourself if it's something that you want to do for that length. MRI and UroLift, is that okay? That's a great question. I think it should be fine. You do have clips in the prostate, but I don't think that there are any issues with MRI with that. Okay. All right. So, can excessive sweating be connected with frequent urination? No, it is not necessarily connected. To my knowledge, there's no specific disorder that connects the two. So you can take that off the list if that's something you're concerned of. Bladder leaks, are they a sign of UTI? Great question. So sometimes they can be. If you normally don't have urinary incontinence, if you all of a sudden get urinary incontinence, it could be a sign of a urinary tract infection. But the most common signs of a urinary tract infection are dysuria, burning when you urinate, having urge, like gotta go, and frequency, going very often to the bathroom. And if you can essentially if those are the things that are all of a sudden happening, specifically burning when you urinate, it's very predictive of having a UTI. But if you're having recurrent infections, it's important to get a urine culture with each infection so that you can be sure that you are truly having an infection and not taking antibiotics without a true bacteria. Okay, I see something about varicoceles. There's so many questions, and I'm just me. I don't have any help pointing questions to me. So varicoceles are essentially when you kind of feel in your testicle and you feel like a bag of kind of spaghetti feeling sensation. That's what a varicocele is. And typically the reason to treat varicoceles is if, one, they are just uncomfortable. Two is if they are causing infertility. So if you have no other cause for infertility and you have a varicocele, fixing that varicocele can be helpful because the varicocele causes an increase in temperature near the testicle, which can make it difficult to produce sperm. Or if as a child, if they have a varicocele and one testicle is not growing as fast as the others, then you can treat the varicocele. Those are the only reasons I would recommend doing a varicocele repair. Otherwise, I wouldn't recommend it if it's not bothering you at all. What is bubbly urine a sign of? So bubbly urine is can be a number of things. It can be a sign of protein in the urine, which it could be a problem with your kidney function, or it could be that you just have a really fast stream. And just based on the physics of urinary streams, you can have bubbles in your urine. So, if you're worried, go see your primary care doctor and have them dip your urine to see if there's any protein in it. Are kidney stones hereditary? So yes, there can be hereditary problems that cause kidney stones. And so they certainly can be hereditary in certain circumstances because there are different things that cause kidney stones, like metabolic disorders and diseases that can be passed on generation to generation. However, a lot of the times they're due to diet. So having not drinking enough fluids, having too much oxalate food in your diet, like spinach and rhubarb, having too much protein or too much salt, those things can all set you up to have kidney stones. Is abstinence unhealthy for penile health? So a lot of people talk about abstinence and doing, trying to avoid masturbation or ejaculation. And I don't think that it's necessarily unhealthy or healthy. It is not mandatory to do any of those things. If your body will essentially take care of these things for you. So if you have been abstinent, you will have essentially emissions in the nighttime so that your body can kind of go through its regular physiologic activities. And so it's not necessarily, there's a lot of data out there saying that, trying to abstain for long periods of time is good for your sexual health or you boost your testosterone. That's not necessarily true. In fact, we have kind of two sides of it in urology. We'll see people who masturbate too frequently, and it's affecting their sex drive because they're watching a lot of pornography and they're expecting that sort of thing during intercourse, which is not realistic. And so they're not able to perform when they need to. And so in those people, we recommend kind of toning it down. In some people, we find that they are not masturbating at all and they're having kind of chronic pains in their testicles or in their pelvic floor. And sometimes we'll even write a prescription like masturbate 2 to 3 times a week to allow that pain and discomfort to kind of dissipate because it's all kind of related in that area. Okay. Question about my son is 5. Should I worry about him accidentally retracting his foreskin too far? No, he won't be able to do that. It's not physiologically possible for him to retract it too far, but you do want to make sure that it's put back after he's urinating or washing and then kind of put back because you don't want to get stuck, which is called a paraphymosis, which becomes a surgical emergency because it can cause swelling of the penis if it doesn't get pulled back. Is masturbating every day a normal thing? For some people, that's totally fine. How do you treat sharp testicular pain? So testicular pain is also a very complex problem to treat. Very often, we will make sure there's no anatomic abnormality with an ultrasound, and then we will consider if you have a high tone pelvic floor or pelvic floor muscles that are too tight that can cause testicular pain, and maybe have you see a pelvic floor physical therapist. And then at that point, I would recommend you to someone who is an expert in testicular pain, but very often, we can experience pain for a lot of different reasons. But first and foremost, it's most commonly, there's a lot of stress and anxiety that can manifest itself as testicular pain in patients who have that in their lives. So can a small testicle still produce sperm? Possibly. You won't know until you get a semen analysis to see if it is producing sperm or not. So that's really the way to find out. What causes a mass on a testicle? So if there is a mass on a testicle, you need to see a urologist, get a testicular ultrasound, and make sure that this is not a cancerous mass. Testicular cancer, unlike most cancers, affects young men, so between the ages of 20 and 40. So it's really important to get screened for testicular cancer. I mean, screen yourself for testicular cancer with a testicular examination and get tested. So someone is asking about penile shrinkage. So yes, your penis will change over time. Very often, if you can't see your penis anymore, it may be because you have an acquired buried penis. And what that is essentially because the weight of the mons pubis, the weight above the penis is so much that it's actually hiding the penis behind it. Weight loss can be very effective for this problem. And after you've lost weight, if you still have issues with your penile length, you can see a urologist to discuss a buried penis repair. A couple people have asked, is it okay to not wear underwear? Yeah, I think it's fine as long as some people are very sensitive to the kinds of tissue, the kinds of materials of clothing that touches their skin down there. And so I recommend wearing cotton underwear if you are going to wear underwear. If you're not and you're not sensitive, that's okay. But do realize that if you start noticing that you're having vaginal discomfort or discomfort in the skin around the penis or on the scrotum, then maybe it's because of the kinds of clothes that you're wearing that are irritating it. Okay. All right. Well, I think, let me see, should be some more here. Okay, I get this question a lot. Thoughts on circumcision? So circumcision is a choice to undergo as a child or as an adult. I perform them on adults, not children anymore, but I do believe in the right for parents to choose because there are significant benefits to circumcision, including reducing the risk of urinary tract infections, sexually transmitted infections, and penile cancer. So that is certainly the reasons for the benefits of circumcision as a child. As an adult, the reasons to undergo circumcision are for things like phimosis, for things like, which is essentially not being able to retract the foreskin and having recurrent infections. And those are, or having pain during intercourse because of that painful retraction. So those are the common reasons for circumcision, or if you obviously have a lesion on the shaft, that can be a reason for circumcision. If you decide to go ahead with circumcision, please watch my video on circumcision because I talk about the risks and benefits of that. So I keep seeing this question, is it normal for an erection to point straight up? It can be, it really depends on each individual person, but you may have a curvature in your penis, which is called a Peyronie's disease. And that is when you have a plaque on the penis, which causes it to curve. And so if that's the case, as long as you're able to have intercourse and it's not bothering you, you don't have to do anything about it. But if it is bothering you, there are a number of treatment options for Peyronie's disease, some which are surgical or non-surgical to help with reducing that curvature. Could cloudy urine indicate any potential issues? So yeah, cloudy urine, a lot of people get worried about cloudy urine because they think that they have an infection. And yes, sometimes it can be a sign of infection, but by itself, cloudy urine is not something to freak out about for the large majority of people. For some people, that's the only way they know they have an infection. But for the majority of normal, healthy individuals, if you have cloudy urine and you're not having any other symptoms like pain with urination, going more often, or having to gotta go, then it's probably okay to just drink more fluids and help clear that urine out. So a lot of the times when you see something weird about your urine, just drink a lot of water, see if it clears out, see if you feel better, and go from there. Okay, recommendations for incontinence. So I've made a bunch of videos on incontinence. There are two different kinds of incontinence. There are stress urinary incontinence, so leakage when you cough, sneeze, lift heavy things, or urgency urinary incontinence, so leakage when you gotta go and can't make it. And they have different treatment options. For both of them, you can do pelvic floor exercises to help either strengthen your pelvic floor for stress incontinence, or for urge incontinence to help you train your bladder to work with your brain, essentially. And then after that, the treatments diverge. For stress urinary incontinence, there are surgical options or pessary treatment, which is a dish-shaped device that goes in the vagina. And for urgency urinary incontinence, there are medications and then third-line therapies, which I talked about earlier today. How to prevent urinary tract infections with urinary catheters? That is a great question and a very important question that I wish I had great answers to, but the most things that I recommend are drinking lots of fluids. You can try cranberry tablets that have 36 milligrams of proanthocyanidins. They have been shown to show some benefit in patients with catheters. And kind of making sure that you irrigate that catheter with either sterile water, sterile saline, to make sure that you get out any sediment. And sometimes I have patients that irrigate their catheters with gentamicin irrigation as well, which is an antibiotic, which can help prevent infections as well. Great question. Is testosterone safe in women? So actually, testosterone is used for sexual dysfunction in women for a number of cases. Of course, the dose is like 1/10 of the dose that men get, but testosterone is actually very important for women as well and can be used safely. Okay. Do Kegel exercises work? Well, so Kegel exercises can work depending on what you're doing them for, but certainly for stress urinary incontinence, they can be very effective if they are done correctly and consistently. It is like going to the gym. So if you work out, you're going to gain muscle, but if you stop working out, you're going to lose it. Same thing with Kegel exercises. If you continue doing them, they can continue to be effective for you, but you have to, one, make sure you're doing them correctly, and two, make sure that you are consistent with them. All right. I don't have, thank you guys. I think that we're almost at 12 o'clock. I know I started a little bit late, but I do have to get back to my family. And thank you guys so much for joining me. I really appreciate you guys. I appreciate your time. I hope you enjoyed it. And if you want to ask more questions or make more videos about certain things, please comment in the comment section of this video so I can look through it and start planning some videos for you guys. Thank you guys so much for taking time on a Sunday to join me. And always remember to take care of yourself because you're worth it.